To actually perform the operation, let's take a cardiac bypass, grafts, for example, you have to stop the heart to actually perform the operation. And once the heart stopped, then you can start grafting the coronary arteries. Now, a large coronary artery in someone who's a Caucasian 6-foot guy is 2 millimeters across. So to actually anastomose, and that's joining a piece of vein onto the artery, we have to make an incision about 6 millimeters long in a vessel that's 2 millimeters wide. And then we take a piece of vein and stitch it onto the artery with something called a 7/0 proline suture. And 7/0 just relates to the size, and it's virtually undetectable by human sight. So we all wear operating surgical glasses. They're like microscopes to perform the surgery. So essentially it's stitching something that's about 3 millimeters onto something that's 2 millimeters with a stitch that's finer than, you probably wouldn't be able to see it with the naked eye. So our future visions for cardiac surgery are lending themselves towards more or less invasive surgery. At the moment we perform surgeries through quite a large incision through the middle of the chest, but especially in valve surgery we can do our valves through much smaller incisions. And our vision really is to have less trauma to the patient, so we have much smaller holes. And eventually to do these operations with videoscopes, thoracoscopes and with robots. And there is good evidence to suggest that for the patients this is much better. They're able to get home much more easily and they have less pain after their operations. So the operating theatres, we have quite an advanced ventilation system inside them which blows air always out of the operating theatre. That prevents infection for the patients and any new heart valves that we might put into the patients in addition. And also the operating theatre is kept at 10 degrees centigrade, and that's quite cold, and that's really to protect the patient and the patient's vital organs. In addition, when we put the patients onto bypass and stop the heart, we do cool them down to about 30 degrees, which is about 7 degrees colder than normal. And this is just to protect the vital organs like the kidneys and the brain. And certainly when we stop the heart to do the operation, we do it by clamping and giving a solution to stop it. And when you take the clamp off after you've done the operation and seeing the heart start to beat again, I think that's one of the most satisfying things, is when you see the heart essentially come back to life. I think seeing in cardiac surgery is seeing a vision for the future. It's also seeing life in the process of the heart. When you stop it and you bring it back to life, I think that's our vision, and that's what I love about our job.